Farooq has left as well. And we are just on time.
Excellent.
But what I want to do now is I want to get the link for this so that I can share it with everybody. It's already live on Facebook. Copy link, and I'm sharing it on our WhatsApp group as well. So it can be posted onto the different WhatsApp groups.
And shall we start, or shall we wait for others to join in?
I think we are ready to start. It's 1:11.
Okay, then let's make a start.
Right, sir.
Bismillahirrahmanirrahim. Welcome to our first series of webinars on how to approach structured clinical examination. We are grateful to University of Gujarat, Mrcp Medical College, and their leadership, including Professor Zafar Gill, for giving us this opportunity. We have registrants from across the world, and I believe we have over 500 people joining us for this session. Now, before I start, let's just go through some housekeeping rules and the format of today's webinar and what to expect in coming sessions. So today we will talk about how to prepare and manage yourself before, during, and after a structured clinical examination. We are grateful to Dr. Imad Qureshi, who has given us his valuable time. He is a very dedicated professional teacher and trainer. I've previously enjoyed his teaching sessions, and I'm sure this is going to be another success with the junior doctors out there. So Imad will be touching on what examiners look for and how you can maximize your chances of scoring high marks during these OSCE sessions. He will also briefly touch on different types of exam stations. So we are not limiting ourselves here to Plab, USMLE, CSA, or AMC examination. So this should help trainees, juniors out there who are preparing for any clinical examinations. We would like you to post your questions that you have in the comment section of this video. We will try to answer them, as many of them as possible today at the end of our session. And if you're not able to answer them today, then at the beginning of our next session next week, we will try to answer all those questions before we move on to planned talk for the next week. And those of us who are not watching us live, they will have also an opportunity to ask the question. We would aim to post these videos on Facebook and other social media platforms, including YouTube. So if you have any questions, please post your questions in comment sections, and we will try our best to answer them later on. So, and from next week, webinars will sort of take more detailed description of exam station types and what do we really want to achieve and how to score them well. And we hope to be inviting other speakers as well and talk about other important topics, especially during these times, like mindfulness, resilience, and time management. And I won't take a lot of your time, but please share the links of these videos to your colleagues to benefit, leave feedback, which should help us in improving what we can offer. What I would like now to do is I would like to invite Principal Mrcp Medical College, Professor Gill, to share his marks, and then I will hand the mic over to Dr. Imad Qureshi. So over to you, sir.
Thank you, Nadeem. Nadeem that told me about that myself. I'm Dr. Zafar Gill. I'm Professor of Otorhinolaryngology and Head and Neck Surgery in that NSMC, University of Gujarat. And my that expertise, according to me, that is in head and neck surgery, and especially that the head and neck cancer surgery. And for those who do not know about my present city, Gujarat, it is a humble town that is placed near shores of Chenab River. in central Punjab, Pakistan. My college, NSMC UOG, is having about 6 sessions has been passed, and still that is in infancy. And alumni association of my college is still very young. Our aim, my aim and my team's aim is to provide that some sort of a platform for my students, for my doctors, to provide skill-based and knowledge-based learning. And the purpose of all that is that to make them aware about the opportunities available domestic, that front and abroad also. And I'm very much thankful to our guest speaker, Dr. Nadeem Thami, who is moderating this session, and Dr. Ahmad Qureshi and his team that will follow that this whole that the Plab and the UKMLA program, that online classes. That program, all that program is a volunteer program practically. That's a free program for all of that who are participating in that sessions. We will make, and my that colleagues and my guest speakers will make all that possible that effort to make this in a success. Maybe there may be some problems that will be improved with time. And we will go today that as we are going through that the Facebook Live, and inshallah in near future we will have that all that programs on YouTube Live also. And Nadeem was telling how to make that the questions and answers. You can make that the questions answer in the comments. You make that answers will be given inshallah during that session or in the next session, or that may be having some sort of a response from our guest speaker on that the Facebook or that YouTube also, or at the start of that next session. And hopefully you will enjoy that all that online learning in Pakistan and other countries. I was telling that to Ahmad and Nadeem, we are having that guest candidates from India. We are having that our doctors from China and even Egypt and Turkey and Ireland also. And that's not only that this region is involved, that the whole of that this part of that world is involved for that having that twist for that sort of learning for that through online classes. And I think you people will enjoy, and I wish that we will have that further session as that Nadeem was telling. Other than Plab, maybe we may be having some sessions on USMLA steps or Australian board also. And again, I'm very much thankful to all that participants, and special thanks for that my moderator and my guest speakers. Over to you.
Thank you for the kind introduction and taking this initiative. Ahmad, can I hand over the mic to you? So please make a start. And once again, we are very grateful.
Thank you very much, Sir Tehami and Professor Gill, for inviting me to come and address this live audience. This is the way that we are heading for in COVID times. We're meeting our audiences through cameras and through computer screens. So it's a pleasure to be here. I don't need to give any introductions to Sir Tehami himself. He is a Plab examiner, he is a Royal College examiner, and he is an exceptional educator, and he's reeled me into this to be a part of it. Thank you also, Professor Gill, for making me, for inviting me to come and be a part of this. So, addressing our audience. Hello, everyone. Assalamu alaikum, and hope that you are having a good day wherever around the world you are. This is going to be a session today in which we're going to talk about an approach to structured clinical examinations. So it's not targeting any one exam. And I'd like to set the expectations clear. If you're expecting that we're going to be doing any practice exam scenarios or sessions, that's not going to happen today, but it may well happen in future sessions. So we're going to talk today about how do you prepare for a structured clinical exam, which is a high stakes exam in most situations. If it's your final year medical professional exam, or it's a PLAB exam, or it's an exam for a Royal College, it's a high stakes exam basically. Every time you prepare for it, you are concerned that if you don't do well, you are going to either not progress or not go on to the next level, or it's going to affect your income in some way. So let's talk about very briefly how you go about preparing yourself for a structured clinical exam to begin with. And Satyami and Professor Gill, please feel free to join in at any point, because I will like to make this as interactive as possible between the three of us. So I had to give a structured clinical exam to come and work in the UK. And just giving you a brief introduction about myself, I am Dr. Mrcp. I am a consultant in emergency medicine. I did my MBBS from Pakistan in Army Medical College, and I did my FRChem 2 years back to become a fellow of the Royal College of Emergency Medicine. So I've had to do quite a few structured clinical exams. And how did I go about preparing for them? So the first thing is you have to be committed to the amount of preparation it's needed to go through a structured clinical exam. And then once you've put aside that time, that effort, and that commitment that you want to have for that structured clinical exam, or an OSCE, which often it's called, what's the next steps? The next steps are trying to figure out what level that exam is aimed at. Is it for a fifth-year medical student? Is it an exam for a new doctor coming to a new country? Is it an exam that's supposed to progress you from being a junior doctor to a more senior doctor, or an exam that's supposed to make you progress to being a consultant? So it's very important to understand what the examination is actually targeting and what level it's aimed at. And this is sometimes an issue that people face, especially when they're very senior people trying to come to a new country and taking an entry-level exam like Plab or like the Australian Medical Council exams. And what they do is that they approach the exam as if they would back home in real life. So they go about it and they say, I'm a consultant in this and this and this, and in this situation, I would do this, 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 and this. Whereas the exam is just trying to assess your level at a junior doctor, for you to show that you are a safe doctor, you're not going to put patients at harm, and you're going to get help when it's required for a person at your level. So this is my first bit of advice to everybody who's preparing for an exam. Understand the exam, understand the criteria of the exam, also try and understand the marking schemes of the exam. So OSCEs usually come with a very, very simple marking scheme. It's a tick box exercise that the examiner has to follow. So let me give you an example. If I tell you to examine, or if I'm an examiner and I'm asking one of you to examine somebody's cardiovascular system, I will have a tick box exercise in which I have to check if you have checked the pulse, check the blood pressure, check the capillary refill time, checked any differences between pulses, seen what the central and the peripheral pulses are like, what it's like on both sides. Have you listened to the heart sounds? Have you looked for sacral or ankle edema? And once you've done all of those steps, you are through with the exam and you have passed that station. So one thing that people worry about is, I've not followed the approach that I was supposed to. But in most examinations, as long as you've gotten all of those elements done, you have ticked all the boxes, you don't have to worry and carry any worry forward to the next station about your performance in the last one. Does that make sense to everybody? I hope it does. And we'll just take it forward from there. So in addition to this, it's also always good to understand what type of exam stations or scenarios you might get. So, some of the examination stations are going to be related to clinical examination of patients. Some of them are going to be regarding history taking. Some of them will be treatment of a patient. Some of them will be management of a situation or a complex scenario. Others of them will be communication skills. Some of them might involve teaching somebody else. And each of these have different formats that, as long as you follow the format and you get all of those boxes ticked, you should score highly in those exams. Another thing I'd like to bring to everybody's attention is that in most exam scenarios now, or in most OSCEs, they're starting to change the way that these examinations are marked. So if you speak to any of your previous professors who've done OSCEs in the past, they might tell you that you had to pass an X number of stations, or you had to pass an X number of skills, and that would mean that you would pass. And if you failed 5 stations out of 15, you wouldn't be able to pass. And this is changing now. What the world is coming to is, in most developed countries, they're moving towards a pass mark. And therefore, if you score highly on the stations that you didn't pass, and you score highly on the stations that you have passed, it's very likely that you will end up passing that exam. And the thing that we'd always like to teach and to get everybody to understand is, it doesn't matter if you fail a station, as long as you get every possible mark that you could, even while you weren't, even though you haven't passed the station, because every mark counts in that total to get you to pass. So moving on from there, let's talk about what's the best way for you to prepare for an exam. So a lot of people will advocate that you should practice, and I completely agree with them. OSCEs and structured exams are all based on practice, practice, and practice. And the best way that you can go about this is to have a partner or a group, and you practice it together. If any of you have done courses like ALS, ACLS, or pediatrics, you will all come to understand that it's exactly the same kind of assessment. You have an evaluator who is holding a checklist, and they're just marking you off. And if you get everything that's compulsory done, you pass. And the more tick boxes you get done, the higher you score. And it's very simple like that. So going on courses like these and getting through that process is a good way to start to practice for a structured exam. If you are an instructor on any of those courses, that makes your chances of doing well in an OSCE even better. I've just been, I understand that we have had, our poster said that we're doing Plab and UKMLA. And I understand that there's a question that's come up, and it's asking, are we talking about Plab or are we talking about the MLE exam? So we are talking about all clinical exams here. Although my experience personally is more related to the UK, but I have done multiple examinations in the UK as well. So you can take this as an approach to attempt any clinical assessment exam, whether that is for the AMC, for MLE, for Plab, or even if it is for your FCPS final exam. Moving on from there, so once you start practicing, it's about getting into the routines and getting into the habits. Something that always troubled me when I was getting through exams was, how do I start the station? What do I say? What do I do when I go in? And you will often get some feedback in a brief before the exam itself. They will tell you to either behave as if the examiner isn't there at all. In some exams, they ask you to go up to the examiner and show them your candidate number, just to verify that you are the right person who's meant to be on this station. But it shouldn't make any difference to you. You go in there and you start in a structured approach. And if you have the first 3 or 4 sentences rehearsed to the point that you will not get that wrong, it boosts your confidence as well. And with that confidence boost, you often get a chance to just start the station well, and you leave a good impression on your examiner and the patient who's in the room as well. So one way that I do it is I go there and I greet the patient. I try and introduce myself. I try and tell them what I've come into, what the purpose of this visit is. And then I start from there. So, hello, my name is Dr. Mrcp. I'm a consultant in emergency medicine. And are you Mr. So-and-so or Miss So-and-so? Okay, I'm here just to see how you're doing, or I understand you're in pain, I understand something's not right. Would you like to tell me more? And always start with an open-ended question. So, would you like to tell me more? How can I help you? Things like that. And they build a very good rapport with your patient or with the dummy patient in an exam. Once you've gone through this initial bit, you are expected to follow out the instructions or whatever is required for this station to get through it. So we're going to touch on these in the future when we have more sessions. But to briefly begin with, sometimes you don't know what to do in an exam station, because when you're stood outside and you're reading the instructions, you realize that you don't know how to do this procedure, or you don't know how to do this particular examination, or you've never talked about this topic before. And in those situations, that is when your grit is tested. So if you've been asked to, in the instructions outside the room, to teach about diabetic foot, and you've not really gone through or prepared much about diabetic foot, but you know a lot about diabetes, you know about other complications of diabetes like DKA or hyperosmolar hyperglycemic states, that's fine. You have some information and you can go about it. So what you can do is you can go in there and introduce yourself, ask them what's going on, and then say, right, so I meant to talk to you about diabetic foot, but I'd like to start with what you know about diabetes and diabetic foot. And then set some objectives, which are up to you to decide. And you can say, right, so as your knowledge about diabetes is quite limited, I think initially we're just going to talk about a little bit about the physiology and the pathophysiology of diabetes. We'll talk about what medications can be used to manage it. We'll talk about some of the complications of diabetes. And then in the end, I'll signpost you to some information sources where you can read about diabetes foot, and we'll meet again in a few days or in a week's time, and we'll talk more about diabetes foot. And it's a perfectly reasonable expectation that you will pass this station. Whereas if you are really, really stressed out and you are, scared that you don't know anything about diabetes foot, and whatever you're going to do, you're going to fail this station, that's just going to add to your anxiety. And it's likely then that you will fail the station because you've already set yourself up for it. Never go into an exam station thinking that you are going to fail it. Prepare yourself while you're outside to say, if you have a minute or two to read the instructions, just prepare yourself. Make a mental plan. This is what I'm going to do when I go inside. And because it always starts with greeting the patient, introducing yourself, asking them their name, trying to build a rapport and telling them why you're here and asking them if you can help them, you know that the first half a minute or 1 minute is going to be fine. And after that, you've already decided in your head what you're going to do. And it's that kind of mental rehearsal and mental practice that makes your OSCEs quite easy and passable. I'm just taking another question while we're in here, and we've had a question that's come in, said, what are the changes in PLAB due to the ongoing pandemic of COVID-19? So I think Sir Tehami, it might be better suited to answer that question. But for the time being, we know that the PLAB 2 exam is currently on hold. They're not going forward. And I will see if I can get some information about that. And we will answer this question in our next webinar. So this was just an example of how to go about with a station that you feel you are not fully prepared to go about. The other things that you need to realize is that the examiners are not there to fail people. They don't go there with the intention that they're going to fail everybody unless they can prove to them how good they are as doctors. The examiners are just trying to make an assessment if you're going to be a safe doctor, if your patients are going to be safe, they're going to be well cared for, if you know your limitations, and if you can achieve the objectives that the people who wrote the exam have decided you need to be able to achieve. So a lot of that is about trying to be calm, try and have a well-mannered voice, behave appropriately as a doctor. And I also recommend that if you take away some of the practices that you will learn for OSCE exams into your daily practice, it's going to make a huge difference. So when we talk about communication skills, OSCEs, you have breaking bad news, or you have having that difficult conversation or resolving conflict, for example. If you take the same approach when you're dealing with people in real life, when you're dealing with patients, when you're dealing with colleagues, it does work. There's a reason why they want you to show us that you can do that in an exam. Because when you can do that in an exam, when you're under stress, then you can probably do it in a little bit more comfortable setting as well at work. And that is why OSCEs are structured in this way. So what else can happen in an exam? I mean, obviously, there are always things that you cannot be fully prepared for. You might have some exceptional circumstances or something that's happened that will affect your performance on the day. Always let the examiners know about that. Tell your examiners that you have had either sickness or bereavement in the family or something that's happened that has affected your performance on the day. For UK exams, if you have language issues, that doesn't really count as something that they will take into consideration. But there are people who find it difficult to read and write, and patients who may not have been diagnosed before, but if they are repeatedly doing poorly on an exam, they can get assessments done. And if they're found to have a condition such as dyslexia, they can inform the examiners, or they can inform the institution or the organization that's conducting those exams. And they will then take that into consideration on how they're going to assess you, whether that's by allowing extra time or giving you any support that you need. So at the end of the day, it is an examination. It is not a situation in which you are going to be, you're going to be treated badly. And that is how all examinations should be. I like to think when you go through an OSCE or a structured clinical exam is to think of it as a day at work. Just go in and think, today I'm going to work and I'm expecting to see 14, 15 patients in the next 2 or 3 hours, and I'm going to treat them to the best of my abilities as a doctor. And I found that that's almost always worked well for me. So it just depends on how you look at it, as an exam or as something that you're used to doing and you've been doing for a while now as a doctor or as a medical student. You've been taking histories since third year, at least, as a medical student. So you've been doing this for 2 or 3 years. You should be all right. In addition to this, there are some stations that are mannequin stations in exams. And those can sometimes feel a little bit tricky, or they can feel a little bit artificial as well, especially with the low fidelity mannequins of the types that you might get to see in a PLAB 2 exam. So these stations in PLAB 2, they include things like putting in a cannula, suturing. They include doing a prostate exam. They also include things like doing a PR, a parectal exam, a pervaginal speculum exam. They can also include taking a cervical smear, for example. and other examinations like fundoscopy and looking at examining somebody's ear. And these are all done on mannequins. Another mannequin exam is a breast examination as well. So all of these can sometimes feel a little bit artificial. And you can also get the feeling at times that they're strange. So approach to that, again, from my side is the same. Go in there, have practiced it before, attend courses or try and find similar mannequins so that you get a feel for what that situation is going to feel like. And then practice the human aspect, the human factors of dealing with those situations. It's very easy to do a PR exam. And I don't think anybody fails in Plab 2 if they got the wrong findings on the PR exam. The things that people fail on are because it's artificial, because it's a mannequin, they don't ask for consent. They don't get a chaperone. They don't respect the person who they're examining as a person because it's a mannequin. And also, when they are finished, they don't ask the patient or to cover up or that tell them that the exam is done and thank them. So those are the things in these mannequin stations that you need to be careful about. Just had another question that's come in, and that is, what is the criteria of specialty after PLAB in the UK? Are there any specific tests or are there interviews? So what happens is, this is now digressing from what we're talking about with exams, but it's just going into a little bit of career counseling, which I think we have time to get through. We're only half an hour into our webinar. So you get to decide what specialty you're interested in. You get to apply for training in that specialty. Some specialties are very, very competitive, and you might find it difficult to find training in a specialty that is competitive without having done a few tests, a few courses, without having some publications, for example, or having a really, really strong CV. So it's a point-based application system. You get points based on what qualifications you have. You get points based on what courses you have attended, like life support courses or ultrasound courses. You get points based on how many publications you have. You get points based on how much experience you have. So it is on merit, but it's not based on just one thing. There are a lot of factors that get considered. And your immigration status or your visa can also be one of them. So there is merit. It is on merit. And a CV is a good way to show people how good a candidate you are for a post, whether that's a training post or whether that's a job in a hospital. So things that you can do to improve your CV are make them standardized, keep it in a simple format, add things with clear headings, and have a systematic approach. And at some point in the future, we'll either myself or we'll try and get a different guest to come and speak to you about CV building and to talk about career counseling as well. So I hope that that answers that question. And let's take this forward to a different, to go back to our OSCE and our structured clinical examinations. So what are you thinking right now? You must be thinking that this might not be what we signed up for. We were expecting somebody to come and tell us what to do in an OSCE station. And I've touched on that a little bit, but like I said, this is our first webinar. We're just talking about approaches to the exam, how to get the most out of it, how to maximize your chances of passing or succeeding in the exam. And if you don't pass a particular station, what can you do to get the most marks in it? And one aspect of that is timing. So if we talk about timing during an exam, you need to obviously know how long each station lasts in the exam that you're giving. And based on that, when you practice, try and make sure that you are close to closing your station when it ends. Now, in some exams, like the PLAB 2 exam, you get a 30-second bell, which tells you that you've got 30 seconds left in this station. And because of that, you very quickly try and summarize or sum up what you're doing. You don't get that happen in other exams or in more specialty-based exams often. So if you time yourself and if you practice and you know that it takes you 30 to 40 seconds to introduce yourself and start the station, then you need to be able to be in a position in the last 30 or 40 seconds to close up your station as well. Because you get a lot of marks for the things you do in the first 30 or 40 seconds, and you may lose a lot of marks if you've not closed properly as well. So a typical checklist, for example, will include comes into the room and greets the patient, introduces himself, confirms the patient's identity, states the purpose of the visit, starts taking a history. In the history, asks this. So asks 12 things in the history. After asking those 12 things in the history, he says to the patient he needs to examine the patient. And he just verbally says that he will examine the heart, the chest, listen to the heart sounds, check the blood pressure and the pulse. After that, he suggests to the patient that he needs to do some investigations. And he says that he will do an ECG, blood test, and arrange for echocardiogram. And at the end of it, he tells the patient that he will find out the results of these investigations, and he will tell the patient what's going on. In the meantime, the patient is going to be admitted to the ward. He addresses any concerns the patient has. He starts any treatment that the patient needs, and he invites any questions. So as you can see, there are 3 or 4 things in the very end that are quite generic, and they're usually the same in most stations for that particular type of station. And if you've practiced that and you've managed to finish that off, you get 4 easy points or tick boxes or checks at the end of the station, just like you get 4 or 5 easy checks at the start. But sometimes when you're not managing your time appropriately, you spend so long in the middle that you don't get to close properly and you miss out on 4 or 5 very easy marks. I remember one friend who I was practicing with, and it was an examination station for a patient. And just as he was leaving the room, because we were practicing it in a room, so I told him your time is up. And just as he was leaving the room, he said, "Oh, can you please put your clothes back on?" And we ticked him off on that. So don't forget that at the end of the day, even though it's a simulated environment and you have examiners and simulated or acting patients, you still have to treat them the way you would treat a regular patient, with respect, with dignity, and make sure that they are comfortable and they do not feel like they were threatened or embarrassed in any way. So when we talk about different types of stations, and we've talked about a few, talked about the mannequin stations, we've talked about communication skill stations, and we've talked about examination stations and education stations as well. Some of the stations that come about are management of complex situations where you might have to resolve conflict, or there might be patients who are more like mental health patients who are aggressive or who don't want to listen to anybody, who are threatening, or who are refusing treatment. So these situations as well, it's, in these stations, it always helps to start with calming voice and just a structured approach. Come in, introduce yourself, and you do all the things in these stations that you would do in real life as well. So never let, for example, in an agitated patient, never let the patient get between you and the exit from the room. Because if that happens, then you are essentially in danger yourself. So don't be afraid to say that this is a risky situation and I need help. This is, I feel at risk or I feel threatened here. So I'm going to ask for security or a colleague or somebody to come in. Something that we never get taught back home, but we get to learn here is that you have avenues to take and you have people to turn to if you are physically or verbally threatened or abused by patients. And in the NHS, we tolerate with a zero tolerance policy. So the policy is that no kind of verbal or physical aggression towards staff in the NHS will be tolerated. And the police can get called and the patient can be arrested and prosecuted as well if we want to pursue charges. So you might have to face a situation like this in an exam where a patient is very loud, is coming close to you a lot, and is acting in a threatening way. So the advice would be the same as it is in real life. Keep a calm voice. Try and keep yourself close to the exit. Don't let the patient come between you and the exit from the room. And try initially to de-escalate. So speak in a soothing way. Try and listen to why is the patient agitated? If it's anything you can address, try and address it. Ask the patient politely to calm down and sit down. And if you've tried all of these things and it doesn't work, then say, all right, I'll be right back. Step outside. Well, don't step outside in the exam, but say to the examiner that I'm going to step outside and I'm going to call for help. So I'm going to ask for security or I'm going to ask for more staff to be here because I feel threatened in this environment. And if I can't get any help, then I'm going to leave this patient here and I'm not going to continue with this examination. And that's absolutely appropriate. Other complex situations that you might find yourself in, or complex stations that you might find, are two colleagues who are having an argument or not behaving professionally with each other. You might have a colleague who doesn't agree with you. You might have a situation where things are suddenly become really, really difficult to manage. So another station that you might get is trying to triage patients or trying to decide who to see first and who can be seen later. So again, have a structured approach to that as well. Because I work in emergency medicine, I always follow the ABCDE approach. So if it's an airway issue, that's the first priority. If it's a breathing problem, that's the next priority. If it's a circulation problem, that's next. If there's something neurological going on, that is fourth on the list, and pretty much everything else is further down the line. So always try to do things to the best of your ability. Have that structured approach when you're prioritizing things. One thing that I learned from my driving test in this country, and not funnily, not from an OSCE exam or a course, was how to give running commentary when you're doing things. So it's nice for the examiners as well that whenever you're doing something, you just give a running commentary. So, for example, if you are putting in a cannula, then one of the things that you might do is you say, right, so I'm going to tell the patient that I need to put in a cannula and take some blood from it. And the purpose is to give this some treatment through the vein. After that, I'm going to identify a vein which I think is suitable. I'm going to apply a tourniquet. And so while you're doing it, actually saying what you're doing. So it's a running commentary. I said, I found a vein here, which I think is nice. I'm going to apply it. I'm applying a tourniquet. I'm cleaning with alcohol. I'm letting the alcohol dry. I've collected everything that I need. I have a cannula. I have a flush. I have something to secure the cannula in place with. I have a sharps box. Okay, I'm passing the cannula through the needle. I see flashback. So I'm going to progress the cannula, but not the needle, removing the needle, taking blood or whatever, flushing through, remove the tourniquet, flushing through. It seems to be going fine. I'm going to secure this cannula in place. I'm going to discard the needle in the sharps box, and all of that done. And while you are doing it and you're saying it, it helps the examiner to, if they're, sometimes they will miss what you've done because they will not have seen it. They might be marking something and you did something and they missed it. Don't give yourself a disadvantage in not getting those marks or not getting those points because the examiner didn't see you. When you do a running commentary, they have heard you and they will always, they will have to mark it as something you have done. So we're getting a few more questions in, and some of these are interesting. So that's what is the estimated cost spent on a complete PLAB journey? Now, obviously, there's going to be some cost attached to coming to the UK, applying for a visa. There's going to be costs attached with living in the UK for the duration of your exam. And those kind of costs are substantive, and it depends on what you do during that time, when you get your tickets and all those things. But I'd say that it is reasonable to expect that you will be spending about £1,000 on trying to complete your PLAB. It may be a little bit more, it may be a little bit less, but about £1,000 is a reasonable cost to expect, including one course in which you're going to be prepared for PLAB 2. Now, obviously, if you have somewhere to live, if you have relatives, if you can stay for a longer period and just take one trip to the UK and do your PLAB in that, instead of having 2 trips, it's going to reduce the cost further. Or if you have to make 2 trips, it might increase the cost. Another question we've just been asked is, are MRCP and FCPS acceptable qualifications in the UK without PLAB? So yes, there are different ways of registering with the GMC, and there are some post-graduate qualifications that allow you to get registered with the GMC as long as you meet the English language requirements. MRCP, if you've completed all 3 parts, is acceptable as a postgraduate medical qualification. You can apply to the GMC and say, I have completed MRCP, I have done IELTS or OET, and this is my score, and I would like to be registered, and you won't have to take PLAB. FCPS in certain specialties is acceptable. So FCPS in anesthesia, for example, is an acceptable entry to the UK. You don't have to do PLAB. Until recently, FCPS in pediatrics used to be the case, but it recently got removed from the list of those qualifications. So there are some qualifications that make it easier for you to enter the UK without having to go through PLAB. I hope that answers that question. Going forward, well, I think we've come to about 50 minutes and we've touched quite a lot. So what we can do is we'll see now if we can take any further questions for the next 10 or 15 minutes, if we have any, and then we will sign off and see you again next week. So if you just give us an opportunity to go through some of these questions, and then we can see. Sandeep, you there?
So, Mark, thank you very much for an excellent overview of structured clinical examinations. I think you've covered a lot. Obviously, it was an overview, and we would like to have more focused sessions from next week onwards. We appreciate the questions asked. And as I've answered during the online chat, that one size does not fit all. So in order to decide which route to take, it's quite difficult to offer a generalized advice. Therefore, you have to assess your personal, financial, academic, social circumstances in order to make a decision. If I give you my personal example, I was always wanted to do USMLE. However, my personal, my social, and my financial circumstances were not did not allow me to pursue that route. It does take a bit longer than Plab. It is a harder exam, and then you have to at times wait for a lot longer to get matched to a program that you desire. And there are people who are disappointed in this process. And if you look at that aspect, then Plab seems like an easier option where you can do the exam, go for jobs. There are lots of jobs available, and it's much easier to relocate from one system to another system and start working. So there are certainly advantages. Somebody did ask me disadvantage. My only advice there was, please do not look at the negative aspect of anything. There are advantages and disadvantages in everything. There are opportunities everywhere. Even a crisis like COVID has presented us with numerous opportunities. And one of the opportunities is right in front of you this morning or afternoon, wherever you are in the world. So please, as I said, do seek advice, but try to find some mentors around you who can probably give you a better advice, more tailored advice to your needs. And that's all I would say here. And I'll hand over the mic back to Imad.
No, sir, thank you very much. You always have wisdom that helps us through and always great advice to give. I'm just trying to go through some of these questions that we've had. And please understand that we won't be able to answer every question today, but we'll try our best to make sure that we at least can offer you a written response to these questions, and they will be added to this group.
We can also signpost you to some of the organizations that are Pakistani based, but there are some Indian, Sri Lankan, and other countries based organizations, and there are physicians, surgeons from those countries who can certainly help you and guide you probably better than I or Imad can do. There are, as far as the organizations are concerned, there are two organizations which are sort of Pakistani descent, Apne and Apps. They have their websites, and you should be able to find links to their website if you either Google or go onto the Facebook pages. You can also, there are some other individuals around who are very helpful. I will not be able to do justice if I start mentioning one or two names, because there's so many dynamic and remarkable individuals around who have helped out international medical graduates. So you will find ample advice. Seeking an advice these days is not an issue, but making sure that advice works for you is really important. You're all passionate and really want to achieve what you want to achieve in life, but please do not get bogged down by whatever happens around you. So as I said, I've given you the example about COVID creating crisis, but at the same time creating opportunities. And everything happens for a reason. Imad, are there any other questions that we can answer?
Right, sir. So one question. So we've had a question that asks us about resources for PLAB 1 and PLAB 2. We will signpost you to these because they are just like Sir Tehami said, there are so many that it would be criminal of us to only mention one or two and not signpost you to every single or as many of them as we can. So there are a lot of resources towards that. There's been a question about how much time does it take to complete MRCP. And I think that, I mean, one
so,
thing that
again, it depends. I mean, there are people who are fortunate enough to pass the exam in first attempts, part 1, part 2, and PACES exam, and that will take you about sort of 18 months to 2 years. But again, it depends on the individual circumstances and your approach. Because one of the other key advice I give a lot of people is you all have the knowledge, you all have the basic understanding, but what majority of people lack is understanding of a different culture. So the one thing that people struggle to get on top of is a cultural shock. So when you come to a new system, you come to a new country, you get a cultural shock. Everything is different, language is different, the way people behave is different, and a lot of people become quite obsequious. So what you will see is in our part of the culture is a lot of people saying, respected sir, kind sir, thank you very much, sir. I've never come across anybody becoming that obsequious here. So it's important to be upright, make sure you're able to express the confidence that you all have. Think about the cultural, how to cope with this. So you've got to have a coping strategy in whatever situation you find yourself in. And it's not easy. I mean, I'm sitting here and preaching as if I'm probably master of it. I'm not. I've gone through difficulties in my life, and I don't think I have that adversity intelligence. But what is important is just to try to think about it, reflect on your circumstances, on your practice, on the events that you've gone through in life, and see how you can, and if you can develop a coping strategy, which always helps. So prepare yourself. There are a lot of other things than just having a basic knowledge to pass an exam, to go to a different country and start working. It's just that understanding that you're going into a different healthcare. They've got a different culture, both in the healthcare and outside. So in the social environment, you'll find yourself. So those things, and it takes a bit of a time, and it all, you will all be successful. I mean, we've all been through this journey. We have maybe a few miles ahead of you, but we're all on the same path, and I'm sure you will. We are hopefully addressing lots of professors and future experts who are out there listening to us. And this is what excites us, and this is one of the reasons, obviously, Imad and myself, we want to, and obviously there are lots of other individuals, including Professor Gill, who wants to help out people. It's because when you see all these bright youngsters, it just excites us. And there are lots of things that we, or at least I, have not been able to do in my life. Obviously, I can't go back 20 years, but what I can potentially do is all those 20 years out there, I can at least help, or we can help to support them to build their career, because your learning, your career is our future, and it's all aligned. So we're all linked together, and we are all one. So it's progress, and our success is mutual.
Absolutely, sir. You're absolutely right. So I'm just going to add one little bit to this question about MRCP and go on to a few others. So MRCP in the UK is an exam that you can take even while you're in Pakistan. You don't have to be in a training program to take MRCP or to sit the MRCP exam. So if you're just talking about purely about how long it takes to get through MRCP Part 1, Part 2, and PACES, Sir Tehami's answered that question. It will take you roughly between 18 and 24 months to get there. But if you're talking about a training program, so training in medical specialties in the UK is often 6 to 7 years. And that is independent of the exam status that you have. So just wanted to touch on that and clarify that. So we've had a question that we've asked again about PLAB 1, PLAB 2 resources, which we will touch upon next week, and we will signpost in the meantime. Question about FRChem as a route to UK residency. So FRChem is an exam that's changing, and that has changed quite a lot. So if we look at FRChem primary, FRChem intermediate SAQs, and the MRChem OSCE, that is a route to come to the UK. You don't have to do the situational judgment paper to get GMC registered. But if you want to progress further with the FRChem final exam, you will be expected to complete the situational judgment paper as well. So for the time being, if you do FRChem primary, FRChem intermediate, and the MRChem OSCE, you can be exempted from PLAB and get registered with the GMC. So we've had 2 or 3 questions asking about PLAB versus UKMLA exam. And I'd just like to clarify this before I hand over to Sir Tehami, because he's the expert on it. But the PLAB exam is the current exam that you will be taking if you want to come to the UK. And in 2023, it's going to be replaced by the UK Medical Licensing Assessment, so the UKMLA. So you don't have to worry about which one you have to do. Up until 2023, we are going to stick with PLAB. And then after that, PLAB will go away and it will be replaced by UKMLA. So do you want to add anything to that, Sir Tammy?
No, as you've rightly said, well, firstly, let me just clarify, I'm not an expert by any means. I'm just a physician working in United Kingdom who've happened to spend about 17, 18 years here. But I'm not an expert, definitely. All we are doing is just sharing our experiences. And I think somebody did ask the question, is it going to be the similar standard exam? Is it going to be harder exam? So please, again, do not look at the exam. Is it a hard exam? If other people have passed the exam, you are also going to pass the exam. There is no exam which you will not be able to. Life itself is an exam. And so please don't think this exam is going to be harder or difficult. So do not look at from a mirror of how hard an exam is. Every exam is possible. What you have to do is, say, for example, when I'm studying, I've got an approach, whether I'm doing a knowledge-oriented study or if I'm doing an exam-oriented study. And this is where you have to sort of differentiate ever so slightly between different exams. That if you're sitting down and doing an exam-oriented study, then you have to focus on those aspects. Say, for example, if you're doing an Mrcp part 1 or part 2, there is each discipline in medicine or surgery have a certain proportion allocated to it. When I was doing my exams, I knew my statistics were not good, so I spent a lot of time on reading about statistics, although it only, I think at that time, constituted only 5 to 10% of the exam. So study has to be either knowledge oriented or exam oriented, but knowledge also gives you strength. It gives you background confidence. And if you have that, then you're able to express in an exam and it comes off. So the reason the exams are made stressful, as they say, sort of your character, your knowledge, your competence is like a tea, and it reveals the strength in hot water. So if you have a strength in your character, and if you're competent and you've got a sound knowledge base, then it comes out. I mean, as an examiner for PACES examination, not for PLAB examination, I can see when candidates are coming, and you can easily differentiate which candidate is which. And as Imad said earlier, you have to sort of walk into a session with the confidence. So if I'm looking at you, I'm looking right in your eyes. And if you ask me a question, and if I have to then answer this question, rather than sort of looking down and then coming back, what you do is you basically, so if you focus in my eyes, you've asked me a question, I'm right looking in your eyes, and then my eyes goes up. And then my eyes comes down to your eye level. And I say, oh, I don't know. And so that's the way I've answered. There could have been another way of answering the question. If you ask me the question, I'm looking right into your eyes, and I goes like, oh, I don't know. So there's a huge difference. So you also have to, it's like, in some ways, it is a way to act. So you have to act strongly. And I think that's all the examiners are wanting to see, because when the patient comes to you, they are terrified, they're scared. With the COVID, there are lots of people are scared out there. Where do they go? They go to the doctors, they go to the physicians. And if doctors are scaring away, who are they going to turn to? They've got no one to turn to. So as a doctor, if you're able to give them the reassurance, and you're only able to give them reassurance if you're confident yourself. You can't, and a person who lacks confidence will not be able to give reassurance to anyone. So what they want to see, as the examiners wants to see from a candidate, is that the candidate has a confidence, and therefore he will be a safe doctor. Again, going back to the first point which Imad made. Back to you, Imad.
All right, sir. No, thank you very much. So we have had a few questions, a few further questions that have come in. So one question I think has been asked, and there's been some response to that, is what are the disadvantages of coming to the UK? So potentially, when I look at it and I see what are the disadvantages of coming to the UK, there are a few advantages. It is closer than Australia and America and Canada is for most of us. So we're able to get home a bit quicker, and we're more in touch with our families. But if you look at pay structures for doctors, doctors in Northern America are paid much more than they are in the UK. Doctors in Australia are paid less than US or North American doctors, but still paid more than doctors in the UK. So everything in life is a bit of trade-off in different ways. You come to the UK because it has one of the best training programs and easy access to a lot of doctors from the subcontinent, from Asia, from the Middle East, from Egypt and other places. It's closer, it's easy to get into. They have examinations that are internationally recognized, like Mrcp, MRCS. You can take in your own country. You don't have to come to the UK to do it, which you cannot do for American exams or Australian exams. You have to go to the country to take their exams. So those are some of the advantages. But the disadvantages, or the things that will pull you across the pond to other pastures, will be things like pays are better in other countries, potentially. There is possibly more recognition and more opportunities to grow in other countries, either because they have a bigger shortage and so it's easier for you to progress, or because they are more academic. So academic medicine is probably stronger in Northern America than it is in Europe and in the UK. So I guess I just thought that it would be nice to answer that question. So we've also had a question to say, what can medical students do to prepare for PLAB, to make their CV look good? When is the best time to take PLAB 1? So the best time to take PLAB 1 is when you get your degree. You take it as early as possible if you want to. So I would say final year of your MBBS or the last few months of your MBBS should be the time you are focusing on English language exams, so that you have 2 years from then to complete your PLAB if that's what you want to do. PLAB 1 is a relatively simple exam, and there is no reason why a few months of preparation after you get your MBBS won't be enough for you to pass your PLAB 1 exam. But it's probably, I think, done either very early or once you are a very experienced doctor. Both ways it becomes easy, but in between, you lose some of the background knowledge and the quickness of your reflexes. What can medical students do to improve their CVs? Do clinical attachments, do volunteer work, go and try things. Go and visit a health camp. Go to a BHU somewhere in your country, a small peripheral health center, and volunteer there. Learn skills like suturing and taking blood or putting in cannulas. But the most important tool that you have in medicine, there's two of them, but the most important tool you have in medicine are your ears. Learn to listen to people. Learn to be active listeners. And that will give you a lot more success in life than anything can. If this was an advice I could give myself 20 years back, this would be it. Learn to be an active listener. And in addition to that, improve your emotional intelligence. Learn people skills. Learn to speak. Go ahead and interact with people you've not met with, or people that you have nothing to gain from. When you can interact with people and make them feel comfortable, they will open up to you and you will get a lot more. So those are the things you can do as a medical student to increase your chances of succeeding in PLAB. And electives and volunteer work are things that you can do as medical students to make your CV look better. Get involved in research as part of your college undergraduate research team. Make publications. And I think that would be my advice to all of you. I understand that there is a question here about Ireland, and I'm not an expert on that, but I will get the information and we will post it as well in writing within the group. And I will try and address that in the next webinar that we have. And one of the last questions that we've had, well, sorry, just a second. So we've had a question about practice in the UK and performance in exams if you have cultural or religious appearance. And I can reassure you that the UK is a diverse and inclusive society, every examiner has to have equality and diversity training, and they cannot discriminate anybody on the basis of their color, on the basis of their language skills, or the way that they speak, their accent. They cannot discriminate anybody with regards to their appearance, whether that is having a beard, wearing a turban, or covering their face. And I think the last question that we will answer today is, can you tell us the total number of seminars you have in queue? So I have, myself and Sir Tehami have committed to Professor Gill for 5 Saturdays. And hopefully after 5 Saturdays, there will be other people who will take this on and keep it going. But we're hoping that we're going to have you join us next Saturday and for 5 Saturdays in total. And Sir Tehami and Professor Gill, I would give it back to you and I will sign off.
Imad, thank you. Thank you very much for an excellent overview and answering the question. Can I just quickly add that obviously it depends. We can carry on as long as you would like us to do, but it will all depend on your feedback. If you believe we are able to benefit you, then please let us know. And if that is the case, then I'm sure we can continue this with the help of other colleagues. We've got some really talented teacher trainers who are we in contact with, and I'm sure they will give us their time to support our future generation. Thank you ever so much, Imad, and I will finish off and sign off by thanking Professor Gill for his kind invitation and taking this initiative. So back to you, sir. Thank you.
Thank you, Ahmad and Tehami. I think that overall that the level of the questions and the participation of the participants were very good, very good. Definitely that as that Tehami was saying, is that how long that all that course will run, or that will have that further lectures. That's that interest level and that questions that you people do put in that by that forum. Definitely that 2 days was first lecture that was very much informative, that was very basic and informative. Different queries of different peoples were there, and I think that was well answered. Both of that are guest speakers, Tehami and Ahmad. I think we will be having that 5 lectures sessions here at the 5 coming Saturdays, and I think that Ahmad will agree that someone else will take in his absence, or I think that that will continue, inshallah. So I think that things are very that okay and in righteous direction, and I'm very much honored and very much thankful to my that guest speakers to have that time for that with people here in Pakistan and other countries who attended this session. That's I think all from 2 days that session. You can have a comments or over that Facebook group after seeing all that videos, or your any of their friends whoever joined that live, they can see all that that this session on that Facebook group, and they can also put that the questions over that, and that will be answered, inshallah. So have a good day, have a good evening and good day. I think that session was very much okay, and I'm again that thankful to Ahmad, to you and Tehami also. Allah Hafiz.
Thank you very much, sir, for inviting us, and Allah Hafiz, sir. Everybody, Allah Hafiz.